Hi, are we all rested, ready to go? This will be a rather long lecture relative to the others, so feel free to stop it, take a break, and do it in pieces. I didn't decide on any logical breaks, so I just lumped all these facial bones together. There are quite a few slides, but we don't need to spend a lot of time on each one since a lot of them are repetition that you've seen before. So let's go ahead and get started. Um, so again, these are the 14 facial bones. Most of them are paired, right and left. And by definition, none of these have contact with the brain. So the zygoma or the zygomatic bones, nasal, lacrimal, the inferior nasal concha, maxilla, palatine, vomer, and mandible. And we'll go through those. So again, feel free to stop this, take a break. I wouldn't go through this probably all in one knockdown session. So let's go ahead and start with the next slide. And this basically divides the skull up into the cranial bones and the facial bones. There's this line that more or less as drawn that divides the facial from the cranial bones. So we're in the facial region. And we'll just go down through the list. Oh, shoot, before I forget, or before I get too much further, let's pause for a moment, back up, let me bounce out of here and go back to these objectives so we can see where we've been up to this point. If you've been going through these lectures in order, we would have gone through all of this material on page 1. On the right-hand side is page 2. We've done all that. We've finished all the cranial bones, occipital, frontal, temporal, etc. And an awkward page break. The temporal bone is now shown all these features over on the left view. So we've gone through all of that. 3 portions of the temporal bone, the 4 important openings. This is a good review. And we've talked about the mandibular fossa, mastoid process, middle ear infections, styloid process, etc., etc. So you should go back and review that. The slides that we're going through are an attempt to illustrate and explain what you're looking at here on these sheets, these 6 pages of objectives. So we finished off the sphenoid bone, the 3 processes, the lesser wing, greater wing, pterygoid process. We've talked about different plates. And we've gone through the foramina, the foramen rotundum, ovale, spinosum, etc. We've done, and we finished with the ethmoid bone. And now we're over to page 4 on the right, and we're starting with the facial bones. And we'll just go down to this list. Okay, back to the slides. So the zygoma or the zygomatic bone shown in green, and I went ahead and put in two processes, frontal process and the temporal process. What I'm interested in you being able to do is to figure out the names. So for example, and you have to remember how these processes are named, the logic describing that. So what would you call this process that I have with the marked with a yellow dashed line on the zygoma? So that would be practice for you. Next slide. Nasal bones, pretty straightforward, not much to talk about, just be able to identify them. There are 2 of them right on the bony bridge of the nose. The lacrimal bones are in the orbit, forming part of the medial wall. They're purple on the left figure. Sorry, the text in the figure a little bit fuzzy at this magnification. but the lacrimal bones show more or less there. And the text on the right indicates that there is a lacrimal fossa, which you can see sort of dotting it on the left. And that houses a lacrimal sac in life, soft tissue, which collects the lacrimal fluid, tears, and drains it into the nasal cavity. There's a little lacrimal canal. So those are the two tiny lacrimal bones about the size of your little fingernail. And then I have some questions again for review. So just follow the leader line. What's the bone and the feature? So it's the orbital plate of some bone. And then the other one, what is this feature? And I'm not talking about this, which I'm drawing in red. I'm not talking about that or the opening, but I'm talking about this part. Okay, so just review as we go through. Next slide. The inferior nasal concha. These are two paired facial bones. And on the left-hand figure, it's shown in green. And in an anterior view, here are those two inferior nasal concha. They form little turbinates that stick inside the nasal cavity and swirl the air. Okay? That's one view, or a couple of views of the inferior nasal concha. And on to the vomer. Forms the inferior portion of the bony nasal septum. So there is the Vomer bone, and it articulates with the perpendicular plate of the ethmoid, forming that bony nasal septum. Bottom view again should look familiar. The bony nasal septum has been removed. And here is the inferior nasal concha again. And then you have these other features also of the ethmoid, superior and the middle nasal concha. So you start to see again features that we've already talked about. Okay, next slide. Is just review exercise. So don't know if I'll spend the time to go through this. I think I'll let you do it. Check yourself, check with your study partners, and get back with me if you have questions. But each box here is hooked up to a yellow leader line. So that's pointing over here. So A is asking what's the name of that feature. B is asking for the name of the bone. So this could be set up like an exam, perhaps, or a quiz, where I might give you the figure with something like this, and then an answer blank where it would say A, B, C, D, etc. And let's say, for example, B. On line B, it's asking for the bone. So what bone is this line pointing to? Well, it's pointing to the ethmoid bone, so you'd write ethmoid. That's the bone. And the feature is the perpendicular plate. And you wouldn't abbreviate, etc. Next slide. the maxilla. Some of this we've already gone through, but it's asking you to identify these different items A, B, C, D, and E. A is pointing to the zygomatic process of the maxilla. B, back to the infraorbital foramen. Don't call it the inferior, it's infraorbital foramen. C is the frontal process, is going up and articulating with the frontal bone, right there. So the frontal process of the maxilla. D is the alveolar process or mass. And there's another slide that we'll come back to that shows this a little bit better. But the alveolar process or the alveolar mass is essentially this part of the bone, it continues on of course, that contains the roots. So that's the part of the upper jaw, the maxilla, that gives support to the teeth. That's the alveolar process or the alveolar mass. Contains the alveolar sockets for the roots of the teeth. And then E is simply the alveolar margin, which is the edge of the bone. And of course, if somebody has soft tissue recession, gum receding, that will cause the bone to recede as well, which of course is permanent. Next slide. Again, review. We're talking about the maxilla as a facial bone. So everything on here should look familiar. The sutures, and this is the hard palate that we're looking at, and it's made up of the maxilla and the palatine bones. So on the palatine bone, there's this horizontal plate that goes back and forth. And the maxilla is referred to as the palatine process because it's a mass of bone that articulates with the palatine bone. Same logic as before. Okay? Next slide. Back to the orbit. An error on this slide, one of the hazards of copying and pasting. This middle orange box says infraorbital sulcus or groove. No, cross that out and write in canal. That's going to the dashed line. The sulcus or the groove is appropriately labeled. So that you've already seen before. But again, you should be able to label or identify the feature and tell me what passes through that. And the same with the SOF and the inferior orbital fissure, etc. Okay, so good practice for studying. Next slide. Here is the alveolar process or the mass that I was just talking about, and it's the same on both the maxilla and the mandible. So both have an alveolar process or an alveolar mass that contains the alveolar sockets that support the roots of the teeth. Okay. Next slide. Still on the maxilla, a few additional features. We have the incisive foramen. This is the anterior hard palate. So again, here is maxilla, palatine bone. You recognize the suture, the median palatine, the transverse palatine sutures. And anteriorly, there is a foramen or a foramen. Sometimes it's shown or presents as two separate foramen. Most of the time, the two have merged into one foramen. But through that, it then branches. If you're going from the hard palate through the incisive foramen, it would then divide into a right and left incisive canal. And on the right-hand figure, The incisive canal is shown through the maxilla, and there's a nerve in that incisive canal. It is not the incisive nerve. It would be very logical if it was, but it's not. It's the nasopalatine nerve that we'll come to later, so don't worry about that since we haven't talked about it. But it is coming through a foramen up there, which I believe is shown in the next slide. So there's the nasopalatine nerve. Every time you see cranial nerves mentioned, I would highlight them just so that you can at least go back later and review all slides that show cranial nerves. Okay, next slide. Back to the maxilla. You've seen this picture before. We were using it to illustrate the infratemporal fossa and the pterygopalatine fossa, but here what I'm pointing out is the maxillary tuberosity, which is this mass of the maxillary bone, posterior mass, as shown by the dashed yellow line. And there are tiny little holes in the maxillary tuberosity, like these little yellow dots that I'm drawing, and those little foramina are passageways for alveolar nerves from the posterior superior alveolar nerve. So the posterior teeth, the nerves that are leaving those teeth are going to be running out through those foramina. That's how they will get out of the maxillary bone, out of those alveolar sockets from the roots of the teeth. Okay, maxillary tuberosity. Next slide. Back to the palatine bones, these two facial bones. Most of this should be familiar. Here's an anterior view on the right of the palatine bones, and here is that horizontal plate which forms the posterior hard palate. Maybe you could identify what this suture is. Let me get rid of that. Can you figure out what that suture is? Once you start playing around with the bones and getting the hang of it, hopefully it'll make sense. Let me know if you get stuck. And I'm sure you'll get stuck at various places, so I hope to hear from you. Next slide. Again, palatine bones, much of what we've already seen. The yellow boxes that I put in are highlighting the greater and lesser palatine foramina. Now these are variable. They sometimes present differently, even on right and left, and between patients. So the greater palatine foramen, these are holes in the palatine bone. The greater is larger. And then we have the lesser palatine foramen, drawing those little yellow circles over in the top right. And this the main figure in the center of this slide is out of your textbook. So again, there's the greater palatine foramen and the lesser. Sometimes there's two lesser, sometimes there's only one. Okay? Sometimes there's three, as shown in the illustration on the top left. Again, they're variable. But there's greater and lesser, larger and smaller. Next slide. Still on the palatine bone. So it's the posterior portion of the hard palate. And I put in the Phenopalatine Foramen. Again, passageway for the nasal palatine nerve, which communicates with the pterygopalatine fossa. Okay, so left-hand figure highlighting the Phenopalatine Foramen. If you pass through that, you wind up in the nasal cavity. Middle view, I highlighted in blue with a dashed line where the Phenopalatine Foramen would be. And on the far right view, the Phenopalatine Foramen is marked in red. Since we're doing review, what would you call that opening? Right-hand view, what would you call that passageway? Not the nerve, but the passageway that we just talked about. Next slide. Reviewing the cranial fossa and fissures, we've already pretty much talked about this. I mentioned the Phenopalatine Foramen again. I think we can pretty much move on from this slide. There's not a lot of new material here. On the box now, I alerted you to know all of this figure. We've pretty much gone through it now. Next slide. On to the mandible. A few features to know. Everything on this slide we're going to be talking about. So the mental protuberance, the portion that juts out. Again, the alveolar process, or the alveolar mass, we've talked about, supports the roots of the teeth. Much of this you've learned in A&P. The body, the ramus, and the angle of the mandible. The mental foramen is not shown very well in this illustration, but there's a hole right there where the mental nerve and artery pass. So the neck of the mandible and the condyle of the mandible. What bone does the condyle of the mandible articulate with? So I'm going to write over here articks, short for articulates, with what bone? Mandibular notch, again, you've probably covered this in A&P, but there is the mandibular notch. And then we have the coronoid process. And we will be talking about the muscles of mastication that move the mandible during chewing. So the temporalis is going to insert on the coronoid process. Don't worry about muscles right now. We'll come to them. The coronoid notch is this portion. It doesn't show well in this view, but it's this sort of concave inward depression of the mandible. Another slide will show that a little bit better. And then we have this external oblique line, which is not shown well. It goes off something like that. It's better in a different slide. Okay, so let's go to another slide. So on this one, you will need to probably enlarge this view on your computer or your tablet, just for ease of reading the labels that I have circled. These are features that are on the objective sheet. So, for example, the top is a pterygoid fovea, or the pterygoid fossa, and that is where the pterygoid muscles will attach. Again, don't worry about muscles right now. Mental foramen, mandibular notch, etc. So you need to just kind of go through this and read the textbook so that you're familiar with the mandible. An important bone for your profession. Next slide. Here's a better view of the coronoid notch on the mandible. Again, it's this region, and now this you can palpate when you know what you're looking for, which you will cover in the anesthesiology portion of your program. You can put your finger in the oral cavity and you can palpate that ridge on the mandible and find it, and you put your finger right on that, and it's getting you located for identifying where to position the needle for an inferior alveolar block. So on the left-hand figure, it says that it's this coronoid notch is about 5 millimeters above this occlusal plane. So if this is the occlusal plane of the teeth, it's about 5 millimeters above that, is the idea. At any rate, that's the coronoid notch. And shown again, coronoid notch, coronoid process. And here's a much better view of the external oblique line or the external oblique ridge. So the coronoid notch is this edge, and then it just extends after a ways and goes into this external oblique line. It's oftentimes a landmark in an autoradiograph to get you oriented. You can pick out that feature. Oh, here we go. So this is a panoramic view. It takes a little bit of getting used to. I'm not going to be asking you to do a lot of radiographic interpretation. But at any rate, here is that external oblique line coming down. It's radio-opaque, shows up as a white ridge, a white line. It's a landmark, kind of gets you oriented. You know what you're looking at. Because sometimes those panoramic views can get rather twisted around. Next slide. Mylohyoid line is a feature of the mandible. It's a ridge, it's a line that goes along like that. It's a ridge, and that's where the mylohyoid muscle attaches, which we'll come to later. The lingula is this little tab that sticks up. There's a ligament of the temporomandibular joint that attaches there. And then there is the mandibular foramen here. And this is the entrance into the mandibular canal, which is going to be the supply route for blood and nerves to the teeth and the bony tissue. So it extends down in deep inside the mandible. So that's the mandibular foramen. What is this foramen out here on the body of the mandible? It's not the mandibular foramen. Next slide. I put this one just to show tori. And torus is singular, tori is plural. But this is showing torus on the left mandible. And tori are bony growths of the mandible. They're completely benign. Some people have them, some people don't. I happen to have them. I never knew what they were for the longest time, but every time they would put in one of those bite wing x-ray tabs, it'd just tell me to clamp down on it. Well, it just drove the cardboard straight into the soft tissue of the torus, and it was rather painful to crimp the bite wing. So at any rate, they're not using those much anymore. Next slide. A picture of an aged skull and a dentulous person who's lost all their teeth. What they lost was the alveolar process that housed the roots of the teeth. So teeth fall out. So take care of your gums. I'm preaching to the choir if I'm telling you to do that. The hyoid bone, just a few more slides in this section, and then I believe we're getting pretty close to being done. Yes. So, oddball bones of the neck. You all remember the hyoid bone from A and P, and the thyroid cartilage. This forming much of the larynx. So you should know the yellow boxes, and don't worry about memorizing muscles at this point. We will come back to all of this in the next unit. But the hyoid bone doesn't articulate with any other bone, it just hangs out there in space suspended by ligaments and muscles. Next slide. Paranasal sinuses, there are 4 of them. Anterior view, have the frontal sinuses, which we've already talked about, looked at. The maxillary sinuses are the largest, and they are contained within the maxillary bone. And don't have a good, I guess this is okay, off in the cheek region, if you will. The ethmoid sinuses, anterior and posterior to the ethmoid sinuses are the sphenoid sinuses. So those 4 make up the paranasal sinuses. You should be able to recognize them from a figure similar to this. You should be able to list the sinuses and tell me which bones they are a feature of. The name pretty much gives it away. Next slide. A couple of notes on cervical vertebrae. All mammals have 7 cervical vertebrae, C1 through C7. And they are all identified by a transverse foramen or 2 foramina, and C1 through C7. So there are the transverse foramina. All 7 vertebrae have it. C1 and C2, the atlas and the axis, I would like you to be able to identify. If I showed you these 2 bones disarticulated, I would like you to identify the atlas as C1 and the axis as C2. Note that axis is not axle, like the axle on a truck. It's the axis. C1 and C2. C7 is noteworthy because C7 forms this clinical landmark. That's the bump at the back of your neck. So when you flex your neck, chin to chest, C7 pokes up. And that's what you can feel as the bump on the back of your neck. You're feeling the spinous process of the 7th cervical vertebrae called the vertebra prominens. Okay? And the bottom right figure is a model showing how C1 and C2 articulate together. The noteworthy feature of C2 of the axis is the dens, which sticks up as a projection. It's also called the odontoid process. What do you think odontoid means here? What does that tell you? Why did somebody call it the odontoid process instead of the bumpy process or something? So, next slide. I won't ask you that on an exam, but you should maybe recognize Concha, or the root. Next slide. Oh, we're done. Voila. So, that's enough for this lecture on the facial bones. And we'll come back and we'll review the openings and passageways for nerves. We're just continuing our way down through the objectives for this section of the course. So, see you soon.